Before we begin, a quick note. If you want to explore books about Hippocrates, his life, the Hippocratic Corpus, and the famous oath, you'll find my Amazon affiliate link in the description and in the first pinned comment. It's there for reference if you want to go deeper into the primary sources and modern analysis. Now, when you hear the word Hippocrates, you probably think of one thing: the Hippocratic Oath, a promise doctors make to do good, keep secrets, and do no harm. But the real story is stranger and a lot darker than a few lines recited at graduation. Hippocrates of Kos, born around 460 BC, lived in a world where disease was often blamed on angry gods, curses, and demons. Yet texts linked to his school show something different: a determination to explain illness through nature, environment, diet, lifestyle, and internal imbalances, instead of divine punishment. He and his followers wrote what we now call the Hippocratic Corpus. Around 60 treatises on fevers, wounds, epidemics, fractures, women's health, prognosis, and more. They carefully described symptoms over days and weeks, watched how diseases rose and fell with the seasons, and tried to predict outcomes based on observation. It's not modern science, but it's the beginning of clinical thinking. At the heart of their system sits a theory that sounds almost occult today: the Pasamtupi four humors. According to this model, the human body is ruled by four fluids: blood, phlegm, yellow bile, black bile. Health is balance. Disease is imbalance. Too much black bile, melancholy. Too much yellow bile, anger and fevers. Treatment becomes a kind of elemental ritual: adjust diet, change lifestyle, provoke sweating or vomiting, bleed the patient, purge the bowels, anything to restore equilibrium. For more than 2,000 years, European and Middle Eastern medicine lived under the shadow of those four humors. In some ways, this was progress. It pushed doctors to look at climate, seasons, and food rather than only gods and demons. But as centuries passed, humoral theory hardened into dogma. Bleeding and purging became routine, sometimes killing patients, long after new anatomy and physiology proved the theory wrong. Then there's the Mao Oath. The Hippocratic Oath, in its oldest surviving form, is a short Greek text where a new physician swears by Apollo and other healing gods to honor his teachers, teach the next generation, help the sick to the best of his ability, keep patient secrets, and avoid certain acts, like giving deadly drugs, performing abortions, or having sex with patients. For centuries, it served as a kind of sacred blueprint for medical ethics. But there's a twist. Most scholars today think Hippocrates himself didn't write it. The style and content differ from other Hippocratic texts and may come from a particular sect or school of physicians, possibly even Pythagorean in spirit. The name Hippocratic gave it authority, and the legend did the rest. As medicine modernized, parts of the oath aged badly. Invoking ancient gods, banning surgery outright, or making absolute statements on abortion and euthanasia didn't match the complexities of modern practice. After World War II and the medical crimes of the Nazi era, the World Medical Association drafted the Declaration of Geneva as a modernized oath, focused on human rights, patient autonomy, and equality instead of ancient deities. Today, most medical schools use updated versions, like the Lasagna Oath or institutional pledges, that keep the spirit of Hippocrates, help the patient, do no harm, keep confidences, while dropping the parts that no longer fit. So how should we see Hippocrates now? On one hand, he's the father of medicine. He broke with pure superstition and looked for natural causes. He emphasized systematic observation of patients. He anchored medicine in ethics, duty to the sick, humility, and the idea that character matters as much as knowledge. On the other hand, his humoral universe became a cage that took centuries to escape, and the oath carrying his name is partly a myth, rewritten again and again to meet new moral crises. For a channel like Black Butterfly Key, Hippocrates is less a saint and more a shadow. the moment when medicine stepped out of the temple, but not yet into the lab. If you want to see how later writers, translators, and scholars built the legend of Hippocrates and how modern bioethics still fights with his ghost, you can explore books about him through the Amazon link in the description and the first pinned comment. That link is an Amazon affiliate link. If you decide to get a book through it, I may earn a small commission at no extra cost to you, which helps support this channel and future deep dives. This video is not medical advice. Modern treatment should follow current science and guidelines, not ancient humoral theory. Even if the story of Hippocrates still haunts our idea of what a good doctor is. Tell me in the comments, do you see Hippocrates as a hero of medical ethics, or as the first architect of a system that both helped and harmed? Subscribe to Black Butterfly Key for more journeys into the forgotten foundations of science, medicine, and the stories we still tell about them. Thanks for watching.